everyone. Welcome to We Are Figuring It Out. This is our third episode. My name is Dr. Angeline Tenge. I am a psychiatrist, and most important, I'm a fellow human being trying to figure out this beautiful, complex thing called life. This is a space that we are honestly talking about mental health, wellness, identity, and we will have honest conversations about the choices that shape who we become. The truth is, none of us has it all figured it out. In one way or another, we are all trying to basically figure out life. So we'll unpack the science of the mind, the stories that we carry, the fears we don't always name, and the courage it takes to grow. So welcome to today's Figuring It Out episode. Today we'll talk about anxiety. And I'd want to...
It's episode 3. This is our third episode. Yeah, and
So this is our third
Just to
episode.
repeat, alafu itakuwa take two.
thing.
Okay, this is our third episode. And we're going to talk about anxiety. I want to welcome my co-host and our current guest, Dr. Katwa. So welcome, Jackie.
Thank you so much, Angie. Season 3. We are in episode 3. We are talking about anxiety. My name is Jacqueline Tallam, and I'm your co-host at We Are Figuring It Out podcast. And today we want to unpack on something many of us feel don't always understand. Anxiety. Yeah? Are you anxious? You know, we have so many questions. Do you say, are you anxious? I feel anxious. But today we have specialists, psychiatrists who will be expounding on that. And we have Dr. Katwa on board, our seasoned guest. And we are really grateful that we are learning a lot from you from our first episode now to the third one. You're welcome, Dr. Katwa.
Thank you. So my name is Dr. Kimutai Katwa. I'm also a psychiatrist like Angie. So we were in school together. That's why I keep appearing in this podcast as a frequent guest, and I'm happy to do so. And I'm here today to assist Angie, our host, and Tallam, our co-host, to figure out what anxiety disorders are. So I work for Nandi County, and I'm here to help them figure out what anxiety is all about.
Thank you, Dr. Katwa. And we will start our episode by asking questions. First of all, what is anxiety? Do you say I have anxiety or I feel anxious? But before that, I would like to ask Dr. Katwa, what is anxiety from the way you understand?
Okay, so I'll start by explaining what normal levels of anxiety is, and also explaining when it becomes a pathology. So let's say you are in primary school, yes, and exam periods have passed, and it is now time to receive the results from the exams, yes,
Yeah.
and the teacher has just arrived with a bundle of canes, viboko.
Yeah.
Yes, will you be anxious or not?
I'll be anxious.
Yes, of course. So in which way will you be anxious? Or else what will show that you are anxious? So of course, maybe you will sweat, maybe you will tremble, kutetemeka. Maybe there will be a bit of dry mouth, yes? Maybe the heart will pound a lot. So that is anxiety. But in this case, it is not a pathological kind of anxiety. It's normal anxiety. Why? Because there is a reason for it. Yes?
Okay.
Meaning that the teacher is about to cane you.
Then that is fear out of
We all know because we grew up in the 844 system and we were caned a lot.
spare the rod and spoil the child.
Yes. So anxiety becomes a situation whereby you get similar symptoms. The ones I've mentioned. Trembling, heartbeat, that is palpitations, dry mouth, maybe sweating a lot. Yes. and then there is really nothing there to be anxious about.
Okay.
So you get those physical symptoms, mental symptoms, emotional symptoms that come with an imminent threat. In this case, a threat maybe of caning, but there is no cane there. There is no teacher there. You are alone in the house. You understand? There is no danger that you can point to and say that it is about to affect me imminently. But you have those symptoms that are associated with an imminent danger. And you stay with those symptoms for a very long time. So that becomes anxiety disorder.
Oh,
So
thank
that's
you.
how I would define it.
Thank you, Dr.
Yeah.
Katwa. Dr. Angie, what can you add on what Dr. Katwa has mentioned? And also maybe give some experiences from the patients that you've met.
So what I can say is we have normal anxiety,
Mm-hmm.
as Dr. Katwa has said. When there's a problem, like when you're in class and you've done a mistake, the teacher wants to cane you, you feel anxious.
Mm-hmm.
When I've gone for an interview and I'm waiting for results or I'm preparing for the interview, I'll feel anxious. But then after the interview or after being caned in class, the anxiety will wear off. When
Yeah.
the problem is removed or the issue is sorted.
Mm-hmm.
But then when you're talking about anxiety, the disease, this is when there's that alarm that keeps ringing. Like, for example, some of those symptoms, like the feeling, sometimes when you're anxious, you feel like you're sweaty, or sometimes you'll feel like there's some bad feeling in the stomach. Those symptoms are there throughout, even when there's no particular or real danger. So that's what I can say when it comes to definition of anxiety.
So from the way I understood, sorry. Yeah.
One thing you should know is that it's not a weakness.
Mm-hmm.
It's just the brain trying to tell you there's something that you need help, or there's something that is not okay. And very many people have anxiety. In fact, you'll find there was a study that was done among young teens. It was found that around 30% of them have a lot of anxiety. So that is children. So when it comes to adults, it's even more. There are very many things that happen in our day-to-day. Like, for example, the political situation, the weather, the financial situation that can give us anxiety.
That we can say, like, we are uncertain about tomorrow. When you talk about politics and weather, uncertainty, right, will bring in
Yes,
the anxiety to...
So another component of anxiety that we may not have discussed is it could lead to changes in how you perceive things. In the sense that,
Perception, yeah.
yes, if you are anxious and if you have anxiety disorder, then in this constant state of worry and panic, which we call a fight or flight response or sympathetic response, you could end up misinterpreting things that are non-threatening to think that they could be threatening. Yes? And that is now where you find maybe I like to use children to describe these symptoms because you can clearly see it in them most of the time. So if a
They
child
can't
is
hide, they just
yes.
they're themselves.
So if a child is anxious, maybe when they go out and the trees are moving, they think that there is something hiding in the trees. You understand?
Is that an illusion, or to me, like, you seeing a ghost and it is not a ghost?
So it's just a altered perception that is caused by that anxiety state. And now it could happen to an adult who has anxiety disorder. So that's why what I want to add on top of what we discussed earlier.
Okay. Now we were defining what is anxiety. Because sometimes you can find people saying, I feel anxious, I have anxiety. You mention it's a disorder, and your end you mention it is a disease.
Disease, disorder.
This is
the same
disorder.
thing.
They're the same thing.
Yes.
Okay.
But
And you also-
now
Uh-huh.
I would exclude the people who say, I feel anxious.
Uh-huh.
Because maybe they have a reason why they are anxious, and then it is a temporary or a transient state.
The way you had
So
mentioned,
meaning-
there's a reason behind it.
Yes, so meaning it will come and go. It will not persist for long. And while it is there, then there is a reason for it. So it only becomes a disease if it persists for too long,
Okay.
or there is no actual reason to be anxious, or the reason or the level of anxiety that you have goes way beyond what normal levels would be expected for that situation.
So from the normal level, now when it exceeds the normal level, it becomes
A disease.
a disease. And I like this quote, like, these too shall pass. Like, I think anxiety, when you're feeling anxious, when you just tell yourself, this too shall pass, it's something that is just on its way, just fading away.
Yes.
And you find a solution to it, and it will solve. And what are the causes of anxieties?
When it comes to causes, we can say biological causes, like for example, problems with the body or brain. So sometimes you'll find it runs in families. This is a group of people who are always anxious about issues. You'll find like maybe the mother worries a lot, so a child worries also a lot.
So it is in the genes.
It can run in families.
It can. Okay.
Yes, can be genetics. Another thing we can say is chemicals. We have chemicals in the brain. We call them neurotransmitters. So there's one that is called serotonin, for example. If the levels are low, somebody might be prone to be more anxious over issues or over day-to-day living compared to people who have normal levels.
What is the highest? You have to do some clinical tests for, so how do you certain like someone's serotonin is high? Just
I'd say we don't
So
test
in,
on that.
in mental illness, typically we don't do tests.
okay.
Yes. But we can be able to tell what is happening with your brain based on the symptoms that you present with.
Okay.
And,
Okay, now the level of serotonin is higher.
Yes, but if you are in very complex setups, maybe like in the Western world, then the tests that could be done include things like positron emission tomography,
Okay.
PET scan, or fMRI, functional MRI.
But
Yes.
okay.
I don't want to explain those because we will go beyond the time that we need to use for this episode.
Yeah, that was why
Yeah.
I just noticed the serotonin. I'm curious about that. Can
So,
proceed.
Other things like hormones, like for example, after childbirth, during menopause, when you have problems with your thyroid, it can cause an imbalance in most of the hormones and it can make you be anxious. And then we have psychological causes. So for psychological causes can be mainly because of stressors in life. For example, if you're in debt, you need money for school fees, you don't have, if your business is not working out, things like trauma, maybe you are in an accident or you've lost a child, a family member, somebody close to you. Chronic illnesses, like let's say if you have an illness like diabetes, which is a chronic illness, it can actually make you be anxious. And also things like caregiving. You can imagine if you're looking after a sick parent, a disabled child, a disabled sibling or a sick sibling, those things can actually make you feel anxious because of the amount of time it needs to take care of them, the amount of finances and such kind of things. And also daily habits that we have, drinking too much coffee, taking substances like bang
Like
or miraa.
drinking too much coffee.
Yes, it
anything
can-
that alters
Alters.
your state of mind.
Yes.
Which coffee alters your state of mind
So
because it
coffee
has
lovers.
caffeine.
How coffee lovers, you love taking coffee, so you can imagine you've been
But
told too much
what I
of
can
it.
say is a glass of coffee is not likely to make it bad.
Once a day or
No. A glass even in a sitting like this.
okay,
So
a
maybe
glass.
if you take like
lot of
4 or 5 glasses of coffee in 1 hour,
Have you?
or you drink some of these potent energy drinks. Yeah.
Aha, thank you for bringing up that. We have a number of people who take energy drinks because they want to be excited.
Yeah. So you can imagine you take like several energy drinks at the same, like one after another successively. They'll make your mind alert, but they also make your heart probably beat fast.
Yeah.
And that can actually make you get anxiety.
Maybe, I don't know, sorry, from our audience, sometimes we might be taking coffee or the energy drinks to lower our anxieties. Sometimes, to me, I thought coffee will help me lower my anxiety.
Now,
If I take too
here
much-
is where we say
Uh-huh.
too much of anything is bad. Yes.
Well,
So
anyway.
coffee is used in small dosages to lower anxiety and maybe could work in those dosages. But in high dosages is when it could worsen the situation.
I can say
Just like alcohol, another beverage that people use frequently to lower anxiety. But if you overdo it, then number one, you become addicted to it. And then number two, you may end up worsening the situation.
Okay.
Like during the hangover period, you could be even more anxious, or during the withdrawal period if you don't get access to alcohol.
I see now, withdrawal period. And
so like let's say the alcohol, it will make you calm
it will
for
relax.
a period, and then after that, when the alcohol starts kicking out, you become
Anxious
Yes.
again.
yes.
It's like a rebound, because you got rid of it, and then now when the alcohol is starting to fade away, it comes back in a big way. Yeah.
And other things like when you scroll the whole day,
Doom scrolling.
doom scrolling, it
Yeah.
can make you anxious. Things like skipping meals, not sleeping, all these things can actually cause anxiety.
Yeah, because
Just to add to what she said, now on biological causes, there is an organ in the middle of your brain
okay.
called the limbic system.
Okay. Yeah.
So this organ has several components to it. So the most important components in that organ, when it comes to anxiety disorder, is a structure called amygdala, and another one called hippocampus.
Hippocampus
Yes.
terminologies. Here to
You'll go
learn.
and read about it. But amygdala is
I
for
think it was
fear.
biology.
Yeah, it's for fear and aggression and rage. So it associates fearful events. It forms associations when you experience fear. Like in the case of the student who was about to be
And
caned.
yeah.
So it associates the caning with the fear that there is something bad about to happen. And then it causes the anxiety symptoms. And then the hippocampus will record it in memory. So that you will always remember the canes as being something bad. And as you grow up, you will end up fearing canes, so that if you see a bunch of canes, even if nobody's about to beat you, you start getting anxiety symptoms. That is racing of the heart, drying of the mouth, blah, blah, blah. But then another issue in the biological component of anxiety disorder is overactivation of a certain part of your nervous system called the autonomic nervous system. And this, when it is activated, especially the sympathetic part of the autonomic nervous system, it causes responses called fight or flight response.
Yeah.
Yes, as opposed to rest and digest response. So fight or flight
Flight,
responses are the anxiety fear inducing responses, or else symptoms of high levels of anxiety and alertness.
That's why
And then the rest and digest responses are indicators of low levels of anxiety. So it flips your responses in favor of sympathetic rather than parasympathetic. But these are complicated terminologies.
Yeah.
You'll go and look at them.
Yeah, from what you just shared, fear of flight and relating
Fight or flight.
Fight or flight.
So
Relating to that, sorry to there was something you had mentioned about caregivers. Maybe when you see your patient is in pain, when you think about that scenario, it will give you to have those anxiety. I was just trying to relate with it. Yeah, maybe you can proceed on what you had mentioned.
I was just trying to say that when somebody has, like, for example, there's a fire in right now,
Yeah, okay.
what is going to happen?
I'll flee.
Yes, you'll look for an exit.
Yeah.
Somebody you'll probably fly away. You're looking for an exit. Somebody else is going to come and see how can we put off this fire? Is there
Finding a
water?
solution.
Yes. So that is fight or flight. That's what normally registers in our brain. When there is danger, it's either you fight it or you
Or you
fly.
flee it, yeah.
And then there was this other
Yes.
one.
But then for somebody who has anxiety, maybe there is no danger, but their body is in state of fight or flight. So you'll find they're their heart is beating. You'll find they'll be sweating. You'll find they'll be very worried over issues, and you can't really. There's no specific issue that is disturbing them.
Should that raise an alarm, or how should someone?
Now,
Because we
what
feel that
usually that
sometimes-
means is, the brain usually has a balance between excitation and suppression, or depression. This is not the depression, the disease. It's just normal functioning of the brain. Calming down, maybe when you are sleeping, it is in a depressed state. Then when you are happy or excited, it is in an excitatory state.
Okay.
So, there are neurotransmitters that modulate excitation and others that modulate depression. So when somebody is anxious, the neurotransmitters that modulate excitation are high, and the ones that modulate depression are low. So the brain is in a state of excitation, and that is why it is in a state of alertness, always being aware of what is going on, as if something bad is happening. So that's why you have those symptoms that excite your organs, like your heart, your intestinal system, your respiratory system.
What happens in the intestinal? Like another because we're going to
the intestinal system will go against digestion and resting, so it will reabsorb everything. It will be very dry, and that's why you get the dry mouth. Yeah, but let's not explain those so much,
because we're heading to the signs and symptoms.
Yes. So when it comes to other neurotransmitters that are released, you have heard of adrenaline rush.
Yes.
So in the central nervous system, we have increased reduction in depressive activity, and that is why the brain is excited. And in the adrenergic system, then we have overactivation of the adrenergic system in the sympathetic nervous system. I don't want to over-explain those ones, but now you need to understand that the body is in a state of excitation, and that will be very important in treatment, because you are trying to suppress the brain.
Now I understand where you come in as a psychiatrist. When you are anxious and it's now beyond normalcy, you now come with the solutions of medication and everything.
Yes.
And I would like us maybe from Angie, how do we differentiate this anxiety maybe in women? There's a way we feel when we're anxious as women.
I'd want to give an example. I once saw a lady who came to me and had done several tests. She had done the normal blood works that we do, like let's say if you suspect there's an infection, she was okay. She had even done a chest x-ray, she was okay. She even went ahead to do a more complicated test that we normally do when you're thinking of advanced illnesses, which is called a CT scan. It was okay. She went even ahead to do another test called an MRI, which was okay. So when somebody comes to see you, you start with the simple things as you progress trying to find out what the problem is. But when I sat and listened to her, she was very anxious because of her pressure at work. At the same time, she had a marriage that things were not so okay. So because of the anxiety, she had this constant chest tightness, kind of feeling. You feel like there's a weight on your chest that was there. She was also describing like she just feels her stomach is bloated, like there's that gas.
You mentioned the intestines.
Yes.
The stomach. So other things that you'll find people will have is probably headaches. Some of them will feel tired all the time. You'll find like somebody who's anxious would probably snap at their children all the time. Like I was late for this podcast.
They're irritable.
I was in a meeting and my child was crying around. So I found myself snapping at this child. So you find like because you're irritable all the time, you're snapping at people around you. Other things would be like you'll find you're not able to carry out your normal daily activities. You'll find you are worried over issues that you can't really solve. And sometimes you'll find they're smiling in the public, they're looking okay, but their inside is like there's fire inside them.
Raging from within.
That's what I can say about women. And you remember last time when we were talking about depression, we said women tend to internalize their symptoms. So they tend to, you'll see that the ones who come with those things like chest tightness, stomach pains, worry, and such kind of things compared to men. Yeah. So
those are the physical symptoms that she's describing. Are the adrenaline rush that we were saying, the activation of the adrenergic system. So the chest tightness would be the vasoconstriction and the increasing heart rate, which will also be felt as palpitations. That is awareness of heart
beating very fast. That also resonates with men, the signs and symptoms.
The digestive systems are those that I was telling you that the intestinal system becomes dry. So it stops releasing fluids into the gut, and the gut becomes dry, and that is how you feel like there is a burning sensation inside there.
We might think it is ulcers or acidity.
Yes, because now your GIT, what we call gastrointestinal tract, is dry. Because it's preparing you for that fight or flight.
Okay, I
yes.
get it.
And then sometimes you find yourself sweating a lot. You find yourself trembling or tremors because the system is activated, it's active. You understand? And the reason why that lady was fatigued is because if your brain and your central nervous system and the peripheral nervous system is always activated all the time on alert, then it consumes a lot of energy. And by the end of the day, you have nothing left. So that's why you feel
You're exhausted.
That will come now with the fatigue and with the headache. You understand? So that's what I have to say about it.
And that applies to both women, men.
Yes, it applies to both women and men. But now how women and men will differ in their approach is that a man is more likely to prop himself up and present to himself as if there is nothing wrong. But the woman is likely to be crying and be expressive about their feelings. And you understand?
Males,
yeah.
You find like some of them will be drinking more than normal. Some of them will purport to be working more than normal.
And the aggression now that she was talking about is more likely to happen with men. They are more likely to act out, to be aggressive.
I get it. So is there a way we can control ourselves how to manage the anxiety and help and treatment, how to go about it?
I would say, before we go to treatment, I think we were supposed to say the different types of anxiety.
Yeah.
I think maybe before the different, for children, children are also prone to getting a lot of anxiety. So some of the things you'll notice is, like recently, schools have just opened. So one of my patients that I see, the mother calls and tells me, my son was supposed to go to school. He's in a boarding school, but he's not. All of a sudden they're saying they're having stomach issues. They have been very well during the holiday. They're now telling me
anxiety is kicking in,
a headache. And one of the few interactions that I'd had with this child is the school environment, being in this boarding place, was giving him a lot of anxiety. So something that you'll notice with children is they might be okay, like for example, during the holidays, but when it comes to, let's say if they're having a lot of anxiety at school, when it comes to going to school,
they start
having issues. There's a stomach
or
ache.
If you change school.
There's a stomach ache.
Funny enough, my own daughter today is at home because she complained of abdominal symptoms at school.
And you know the problem.
I don't really think she has anxiety, but she just did not want to go to school because it's opening week. And she's not in the mood to be in school. So she complained a lot to the teacher, and the teachers nowadays, they are sensitive. So she was allowed to come back home. But now on arriving at home, just like that, the abdominal pains disappeared.
We relate with that. I know we relate with that.
So as Angie says, because children present with atypical symptoms when they have mental health disorders, who knows, maybe my child is anxious and I was not aware.
And as a psychiatrist, okay.
But what I can say is that sudden change of situations can also induce anxiety.
Oh, sudden change, like?
Yes, like let's say today you get a job in Mombasa and you have to move from Eldoret to Mombasa.
Oh, yes,
definitely you'll be very anxious, yes?
Yeah.
So part of it will be normal. But if that anxiety persists beyond let's say 6 months, most days you are anxious than not, then we would say that you have anxiety disorder.
And now that we have the elderly also.
Yeah, so for the elderly, things like poor sleep, they'll be feeling dizzy, headaches, poor appetite, they feel tired all the time. These are some of the things that might.
And then elderly people will have a tendency also to describe their imminent mortality. They start discussing with people about how their friends have gone.
I relate with that. They keep mentioning, hey, I saw somebody.
And now, without expressly telling you, that they also want to, to join their friends. But it's like they want you to kujijazie. So if that happens, then it could point out to mental illness in these elderly people. So either anxiety or depression, and it usually comes together a lot.
Okay. Also, anxiety and depression can come in together. And from the examples that you've given, I think I can get some types of anxiety. We have normal anxiety.
Okay, so
also we had mentioned biological, the genetic type. So you can just.
So I'll say these before now. I allow Angie to describe the ones that I have mentioned. Is that there is a normal everyday anxiety.
Yeah.
Like if I was to do the podcast, I could be anxious. Even right now, I could be anxious. So that is normal anxiety. The abnormal one is when we said that it lasts for more than 6 months.
Yeah.
Most of the times than not. So meaning half of the times it is there, half of the other times it is not there, but now it is there more than half of the times.
Okay.
You understand?
Yeah.
And then now for specific types of anxiety, when you come now to pathological anxiety, so meaning anxiety disorder, not the normal type, then we use DSM-5 to classify them.
DSM-5.
Yes.
Okay.
And now we have categories like generalized anxiety disorder, specific phobia.
Phobia comes in.
Yes, phobia.
Okay.
Social anxiety disorder, what we call selective mutism, another one called separation anxiety disorder, another one called agoraphobia.
What is that?
Specific phobia.
A specific phobia.
For what?
Specific phobia. I think let Angie now continue defining them.
We have so many types of phobias.
So we have like now when you're talking about generalized anxiety disorder. So when I say generalized anxiety disorder, what happens is you worry about everything all the time. Most of the time you're just worried about different things and you're not able to control your worry. And you find it comes now with those symptoms of you're feeling tired, or maybe you're having, your heart is racing, and it will be most days for at least a period of 6 months. Let's say that is generalized anxiety. And then we have like panic disorder. You'll find like some people will just be fine, and then all of a sudden they get this panic attack that will last for a few minutes, whereby they feel like their chest is being...
They are breathless.
They're breathless. Their chest is being smothered. They feel like they're just sweating and all that. So
I would say like it's almost like the world is ending.
Yes. You feel like the world is ending.
Yeah.
So that is a sudden attack. And then lasts for a few minutes and then it goes
And then there is nothing specific that you can say caused it.
Yes.
Yeah.
And sometimes also because you keep getting these panic attacks, you'll find that somebody gets anxiety, that they might get another attack.
Yeah.
Yes.
So it is self-reinforcing, or what we call it is in a feedback loop. That's what we say. That the anxiety causes more anxiety, and even the thought of having a future episode of panic causes another panic.
That's why you can find some people say, I have anxiety.
Yeah.
They believe. But I think it's a feeling, right?
Yeah.
If we now on identity, like I'd encourage us in order to own it, like identify yourself with, I have anxiety. Maybe you can say, I feel anxious about this, so that we can say, this too shall pass, so that it can just pass, and we won't allow it to build up to becoming a disorder that will, you mentioned, if it takes 6 months or more, it becomes a disease.
Yes.
Yep.
And then we have separation anxiety.
Yeah, that one.
This one happens mostly, it is normal in young toddlers and children. So it is not abnormal in that stage. But now when a child is like 15 or 17 years old, and or even an adult, and they can't stay alone, that if someone leaves them alone, they panic and they become anxious.
Even like married couples, when you're left alone in the house, you're like, no, I can't stay.
Yeah, that is a bit concerning if it happens. But that's exactly what we are saying, that when you're separated from someone that you are dependent on, then you become anxious. And then we have another type like a selective mutism. So selective mutism is someone who becomes mute when they are anxious.
They just go silent.
Yes, they go silent. Yes, or they pick the people that they will speak to. They can't speak to everybody. Or they pick situations that they can speak. Find some will only speak when they are asking for food, but other times they are quiet. That one is selective mutism, which is kind of it could be a symptom of psychosis, and is it so?
It can be a symptom of
Or
another
catatonia.
illness.
Yeah,
But then that's why we say, so when some of these things happen, please send them
to the
to
psychiatrist.
the psychiatrist.
And then
so that
the
we
other,
can find out.
yeah,
The other one is social anxiety.
social anxiety. Yeah,
So you'll find, like, for social anxiety, these are people who become very anxious when they're in a social place.
Yeah.
So, like, for example, a child will not raise their hand in class because they fear that if I raise my hand and I say something wrong, people are going to judge me.
and then Tallam, what you can relate with more when you're in a date. The man is trying his best to please you, but you're very anxious.
Or before you expect a proposal.
No, maybe first date.
Oh, taki kuchoma.
Yeah, so that's why you,
Don't
So you decide you're not going to talk.
yeah.
keep
Which others? Agoraphobia.
Agoraphobia is a
phobia,
type of specific phobia whereby you fear being in closed spaces. Yes.
like the lifts or
Yeah.
dark rooms.
Yes, lifts, dark rooms. You fear even getting into a supermarket because you're like, if I go to the end of the supermarket and then a fire comes,
Yeah.
how will I run out of that?
And now specific phobias, there is a very specific scenario that you fear, and the level of fear is not rational. So let me give you an example. Agoraphobia has already been given as an example. Claustrophobia is another example. So you can't even go to the toilet or latrine without having the door open. Yes, because you fear being in enclosed spaces. Another one is like arachnophobia, which is fear of spiders. Yeah.
Yeah, fear of spiders.
So we all fear spiders, but now it goes beyond. There's another one like fear of heights.
So you can't come
To high
get
place.
into a building. Let's say you're going to a building for a meeting,
Yeah,
or like let's say your work.
even
office
aeroplanes.
is in a tall building. You're saying you can't get into that building because you
Yeah.
feel like you might.
And water.
down,
Also,
something like that.
people fear large bodies.
Exactly, large body of water.
So it's normal to have anxiety, but when it gets to a point that it affects your social,
And occupational.
functioning, it becomes a problem. It gets to a point that you're so anxious all the time that even concentrating in class or even concentrating at your work is a problem.
Yeah.
Then you need help.
Okay, and what help is it available for someone who has these phobias? Is there a treatment?
So I'll describe it in. Okay, so we always approach help in psychiatry in forms of biological, psychological, and social. So I think I'll talk about the biological. Then Angie will tackle the psychological and the social. So biological, we have already described the biological mechanisms for these phobias and anxieties, and that is overactivation of the central nervous system, as well as the adrenaline in the peripheral nervous system. So you are tackling all of them. Yes?
Yeah.
So in the central nervous system, you are trying to lower the excited state that the brain is in. I told you that the brain has a lot of excitatory neurotransmitters. So you are trying to increase the level of inhibitory neurotransmitters and reduce the level of excitatory neurotransmitters. That's something you can read about.
Okay.
But one of the biggest molecules to target, the two biggest molecules to target, is for short-term relief, we target a molecule in the brain called GABA.
Okay.
So that is what alcohol also targets. So you want to increase GABA activity. So in that case, we use a category of medicines called benzodiazepines. One of them is diazepam. Another one is alprazolam, commonly called Ambien. Another one is maybe midazolam, but I don't want to delve into the names.
At least we have medication.
Yes, medication. So that is if you want to relieve the anxiety immediately. So in the central nervous system still, and this one takes a bit of time to effect, is you are targeting serotonin. Angie said that anxiety is caused by low levels of serotonin. So you are giving drugs that increase the levels of serotonin. And famously, 2 or 3 years ago, there was a lady at the town hall in Wasingishu County who asked people, do you know what antidepressants are?
I think
Yes, some people knew because maybe they have interacted with them, others didn't. So antidepressants are the drugs that higher the level of serotonin in the body. But as I've told you, it takes up to 4 to 5 weeks, 6 weeks to start working. So you'll need short-term measures, which include short-acting medications like benzodiazepines and psychotherapy.
That is
if
now
somebody's in a crisis. So finally, on biological treatments, is now we are out of the central nervous system. We are in the peripheral nervous system.
okay.
So we are targeting this molecule called adrenaline. So we want to reduce it. So we give adrenaline blockers. So they block the beta receptors of the adrenaline. So these are drugs that end in lol. And it's not lots of laughter.
I was like, I wanted to ask, what is
These are drugs that end in the name lol. So propranolol, atenolol.
Tamila Rajit.
Yeah.
To all those who are pharmacists, or those who
They will know.
you will
But now if you go
understand
to your doctor, you can leave the technical bits to your doctor.
That's why right now when you mention all those, I'm like, I don't know, but at least now I know there's medication for
Yes.
anxiety, and you have to get prescription from the
Definitely. Any drug that acts in the central nervous system needs a prescription.
And
So that means the benzodiazepines and the antidepressants, those ones will definitely need a prescription. So these drugs that are beta blockers, adrenaline blockers, may not need a prescription because they act in the peripheral nervous system. But you still need to be aware of the dangers
they're
of
dangerous.
using these drugs because they lower the blood pressure. as
So
well.
you can't go just over the counter and prescribe.
Yes, because now if you're on antihypertensives already, and you go and take propranolol for lowering anxiety, then you could drop your blood pressure further, which could be dangerous.
So as we try to figure out on that, don't try figuring it out on your own.
Yeah.
Seek a professional.
So we have the
prescription on that.
psychosocial approaches, which Angie will cover.
Yeah.
So when you talk about psychosocial, it's treatments that we give that are not medications. So there are different kinds of therapies that we will give based on your situation. So like, for example, this therapy is called cognitive behavior therapy, whereby they're trying to train your brain to identify issues that might be causing the anxiety and look for behaviors that can help you deal with the issues of the anxiety. And then things like, for example, exposure therapy, if you have a specific phobia. So if you're scared of, let's say, heights, what we can do, and you need to, your school is in a building that is
High,
a
like
high building,
floor.
a floor that is high or something, or like let's say your workplace and all that. You see, it affects your day-to-day functioning. We can start by just taking you to where the staircase is and showing you the staircase. And then the next time we make you climb.
That
2,
one
3
is called
stairs.
gradual exposure
Oh,
or
gradual.
graduated exposure.
Graduated.
So you take small
Gradually
steps, baby steps.
until you're able to manage that.
Yeah.
And
For some people, you do something called flooding. Like, let's say you're scared of spiders.
Yeah.
We just put you in a room where there are a lot of spiders.
why?
You become anxious until you eventually.
Until it
And
comes
we
down.
lock
Yes.
the room. But
don't
anyway,
try
we
that.
rarely use that because it could be trauma inducing.
And
Yes.
talking about that exposure, maybe I can mention of claustrophobia, fear of public speaking, something that we are working on. If you fear public speaking, we expose you to opportunities where you get a chance to speak up. And we have Toastmasters International,
Yeah.
Eldoret Toastmasters
Exactly.
Club, and we have Ball Speaking Space for more coaching. And now we expose you to speaking in front of people.
You can
And
start with the 2 people,
yeah,
then graduate to 3 or 4.
Yes.
as we continue with
And
the
then things like just counseling or talk therapy about your fears without being judged, and then eventually getting to solutions, and things like body relaxation techniques. Like, for example, if something is making you very anxious, like if you get a panic attack, you know that just sets in within minutes, it's gone. Like tell you to breathing exercises. Yeah. So
Think about positive things.
positivity energy.
Think about things that bring you comfort.
Okay.
yes.
I think those are mindfulness techniques.
That is like mediation and yoga.
Yes.
So at least we have a number of ways where we can seek for help, treatment, and get to face this anxiety. We are anxious over so many things, and at figuring it out, we are figuring it out how to go about it. And from our experts, we have learned a lot.
So other techniques could be like CBT, but I think Angie, you talked about behavioral activations, India.
That's just on just try to give examples of what we do. But then when you come to see us, those things are very detailed. We're just trying to make us understand. We won't get into
In-depth.
Nitty-gritty. Yeah.
A good one, nitty-gritty of it. And as we wrap
And
it up,
sometimes when we get into nitty-gritty, you become anxious. Because we are talking of terminologies that you don't understand.
like right now, I don't want to be anxious, but there's a lot I've learned. I believe from our audience, there's a lot you've learned about anxiety. And we're going to we are figuring it out together as a team on how to face this anxiety so that it won't affect us in our normal day activities. We need to be productive. We need to be the best versions of ourselves. And as we wrap it up, I know there's a lot we've learned from our audience. Do you have any question? Just comment, subscribe, and share.
We will answer the comments.
Yeah, we will answer the comments now. We have Katwa. We'll give you the comments. Ask any question basically, and we are here to help you figure it out on anxiety.
Yeah.
We've talked about anxiety. And as we wrap it up, I'll start from Dr. Katwa.
So we have all ever been anxious every once in a while. Yes. And it is not abnormal to be anxious as long as it remains to be every once in a while. But if you find yourself being anxious throughout and having those mental symptoms like fatigue, overthinking, feeling like the world is about to end, all those things, and the physical symptoms like the chest tightness, the abdominal movements, the breathlessness, the dry mouth, the trembles.
Yeah.
Yes. And you have it be happening all the time. Yes. So you have it every day, most days, continuously for 6 months, 1 year. Then you should know that something is not right.
Okay.
And then in that case, you seek help that we may help you. So you can go to any of these hospitals where we work and we will help you.
Thank you so much, Dr. Katwa, on that. And I know you offer the best services on medical point of view.
I think any psychiatrist will still offer good services. But it would not hurt if you come to me. I will not complain.
As I say, Dr. Katwa is from Nandi and is also available.
Also working in Eldoret,
Eldoret. Thank you so much, Dr. Katwa. And from my end, as your co-host, this anxiety we face, fear of public speaking. And I'm here to help you out, give you a solution. Join Toastmasters so that you get to build up on how to overcome that fear, that anxiety that you all struggle with. There's a solution for everything. Join Toastmasters anywhere within Kenya and across worldwide. It's available. And also in Eldoret, you can join for more coaching sessions. You can join me. You can reach out to me at Ball Speaking Space. We get to overcome this anxiety that is facing us, and we are all facing it. And we have tackled it. I was once very anxious on public speaking, and look at me now, here on a podcast and sharing with you. Get to know that these too shall pass. Any feeling that you have, when you find a way out, these too shall pass. Thank you, and kindly subscribe and comment on our podcast. And as I welcome our host, Dr. Angie Tenge, to wrap it up for us as we finalize.
So as we finalize, I just want to say anxiety is common. 1 in every 4 Kenyans will face it. So it's a very common illness, and many people are struggling with anxiety. You're walking around carrying a burden that can actually be treated. So anxiety is common, anxiety is treatable, and you don't have to carry anxiety with you because it actually affects your life one way or another. So thank you for having us. Thank you for being with us in this 3rd session. We look forward to seeing you during our 4th session. Over to you.